AFCON 2015. Apparently, Morocco is pulling out, and Ghana is simply offering, the opportunity to do that. It's saying, yes, if Morocco is not interested, and if South Africa has also indicated that they may not be interested, yes, here we are, give it to us, we will host it. But there appears to be a lot of concern about it. Let's know what you're thinking. Let's now have your messages on that issue. Why should Ghana not host it? Abraham, why should Ghana host 2015 AFCON tournament when we know that Ebola is lurking around, and even the Guinean, our game with Guinea in Tamale this week, the World Health Organization has had to issue an alert that we ought to be extremely careful.
I'm not sure that is the current position. What I know is that Morocco has asked for a postponement of the tournament, and CAF is not in agreement. But Morocco has not indicated that they will not host. But
what do you know is the reason for the request for a postponement?
Yes, it's because of the Ebola. Now, there are reports that CAF is looking for a new venue, and that Ghana, South Africa are being proposed. Now, my information is that it's not as if the CAF has made a direct approach to Ghana yet. The Minister of Information was asked the question whether Ghana is ready to host. And what he said was that in terms of facilities, yes, we are, because the stadia are there, but they will seek further advice in the light of the Ebola. They will seek further advice from the medical fraternity to see how they can, if Ghana wants to host it, how it can be done. So we are not there as if to say that Ghana has taken a stand that we want to host it. We are of the view that if...
What further advice are we going to seek for the medical fraternity? The Ghana Health Service Ghana Medical Association has already issued, its view on the issue. Let me read to you what Dr. Sarkodie has had to say, and just listen to him. He says that I seriously, vehemently say that Ghana should say no to this, and at this time, even 2017, that we are contemplating. If we think that at that time we assess the situation and it is safe for Ghana, we take. If it is risky, you drop it. But they are very, direct in saying just don't allow this to happen. He says that it is not an issue of preparedness. It is an issue of taking a risk. We are aware this tournament comes along with a lot of people from other areas. If you think that Guinea and Liberia would not qualify, it doesn't matter, because people can move from these areas because of football. Now, listen to Dr. Justice Yankson, who is the Deputy Secretary of the General Secretary of the Ghana Medical Association. He says if people are going to be here for more than or close to a month, some could come in at a point where they do not have a full-blown infection or are not exhibiting the symptoms, but the same symptoms could come in after they have already entered the country. This is something we need to think about before we take a final decision. We really need to sit down and do our homework well.
So government will take on board all these concerns. Government will also look at the potential risk that this disease poses. And I like the portion that the doctor indicated, that it's not about our preparedness, but it is about the risks that we are taking. So government will also have to take on board this risk. That's the potential of having Ebola in this country. But see, last week we played Guinea, and I was told that Guineans crossed the border and they were part of the activity in in Tamale. Is it always the case that if you even prevent people from coming into your country, you can still have a foolproof system that would ensure that you don't have Ebola? Because we have situations where America has recorded Ebola, Spain has recorded Ebola, and so if it is the fear that Ebola may come into this country, it will come if it will come. It is not just because of the hosting the fiesta. So government has not taken a decision yet.
Not hosting the fiesta is a precautionary measure.
Yes.
That's the suggestion.
Yes. So what I'm saying is that government will take all these concerns on board. In any case, who are those who are going to be participants in terms of stakeholders when it comes to the football matches? You have the supporters, you have the Ghanaians who have to troop to this field. And so government would not put the lives of its citizens in jeopardy. And I'm sure all these things will come on board if CAF formally makes a request to the Ghanaian government to host it.
I see. Now, Kuku, I've just read out what someone at the Ghana Health Service has had to say, and also the Ghana Medical Association has had to say. In respect of the Ghana Health Service, I was quoting the head of disease surveillance at the service, that's Dr. Badu Sarkodie. There are those who are saying we should take a posture just like Morocco, or as we are learning, just like South Africa. South Africa appears to have issued a statement. I just picked one, and it stated, among other things, including its own financial constraints that they have in the country, for which they will not be interested in hosting. But aside that, they make the issue of Ebola a major concern. It says the tournament, as is also a concern for Morocco and many other countries in the world, may also pose a challenge on how we can grapple with the Ebola challenge engulfing the continent at the moment. Should we be considering it at all?
Very tough one here. My mind, defers to the professional caution that is being put out there. But my heart is resisting it. It is Ebola phobia. Will neutralize us. Will make us, sometimes emotional or irrational. We'll go for a policy of isolationism, Jufiasm, which I don't think is a progressive policy. I have a difficulty. I'm a football fanatic. Are we suggesting for a moment that we should suspend football tournaments on the continent until further notice? And for how long? Can't we look at our capacity to contain this? I don't know. You see, I'm split. I have to be honest.
Funding in support of this is not forthcoming.
Oh.
Suggestions are that if we're going to get extra money, already we are at IMF begging for, some money. If we're going to get extra money, we should channel it into other aspects of the economy.
So we should
use some
suspend
of it
football
to fight Ebola, but for our internal purposes, and not go the extra mile.
When do we think Ebola threat will end? Do we have an idea? Time scale? So for the next 10 years, if the threat is there, we don't play football. Some of us, football is like a religion. That's why I'm split. I have a split reaction. And I'm being very honest with you. I can understand where the professionals are coming from because they know they have the requisite competence.
Right.
I don't come near it. But I'm wondering, is that the solution? Are we going to recoil in the face of Ebola phobia and get neutralized on all levels? Then it's not only football. There are many other contact things that we may have to suspend and close up. We call into a shell, the Ghanaian shell, and stay put here. Perhaps even stop Ghanaians from traveling outside because they could go, contract it, and come in here. And we can't stop them from entry because they are Ghanaians. Is that the way forward? can we enhance our capacity to think deeply and find ways and means of containing this phenomenon? You see, that's why I said my instinct is voting with my heart for us to go along and, open up and play the football and not be neutralized.
Okay.
But I don't know.
But there are those who are saying that in a particular year, that was Second World War, the FIFA World Cup was postponed because of
We are talking
the
of
war.
Second World War.
Yeah. So people are also arguing that this could be seen as a global phenomenon, and that you should also postpone.
For how long?
Yeah.
Okay.
But the war, how did you know when?
Okay, just hold on. Dr. Asare, I'm holding in my hand a report that was done by Michael Eli Dokosi of the Ghana Web, and he sought to bring together people's reservations on social media against, and almost everybody that he sampled, quite a lot of people are against Ghana even thinking about it.
Literally becoming xenophobic.
Yes, even thinking about it. And this is what, for example, Rawlings' daughter, Senator Rawlings, had to say. She said, so on what basis are Ghanaians being reassured of their safety in the midst of this rather questionable Ebola pandemic? Let me guess. We have a no-fly zone which the virus is adhering to. Just wondering. That's what she said. She's just wondering about that. And let me share with you just a few more of some of the comments that people really very concerned have had to say, and use that to suggest that Ghana should not at all contemplate in the first place, and to talk about, showing to the world that it was ready to host this tournament at all. Okay, so you just move on and tell me why you think that we should be listening to these views and completely issue a statement like South Africa and Morocco and say we are not interested because of Ebola.
Yeah, first of all, I don't think that, just based on social media comments and based on emotional.
These are Ghanaians talking.
No, I understand perfectly. Social media comments about this particular situation should be the basis for government just saying that no. I think that, we should go the line of what Dr. Youngson said, and when he said that we have to do a proper analysis, risk-benefit analysis of this project, and then take a decision as to whether we're going to go ahead or not. Everything that we have to do, we need not to be, acting just based on impulse. This particular issue, I think people are responding to it on impulse basis, because you have to sit down and analyze.
You think they don't have genuine concerns about the assurances of their health?
No, they do have genuine concerns. As for concerns, they are genuine. And I'm saying that, for instance, if you take Ebola, I'm not, I have resisted a lot of temptation to comment on this, and even on the social media, because my view seems to be different from the view of the majority, and sometimes I don't want to hurt people's sensibilities in trying to talk about this issue. But when you look at Ebola over the period, throughout the time that Ebola emerged, and even before this particular pandemic, those people who have been infected with this disease have been those who are either health officials or close family members of infected persons. There hasn't been any one single record of an infection that has been documented at a public gathering like this particular fiesta that's going to take place. So if you want to talk about,
you want to wait to be able to have an example of an infection that comes to a public gathering.
No, I'm saying that when you take a decision, when you're taking a decision, it's based on information, it's based on knowledge. So first of all, the scientific knowledge about Ebola, how does the disease transmit? And sometimes getting that information is also based on documented evidences of how the disease has been behaving, and also the biological analysis of the virus itself.
How do you reconcile what you are just saying with this, fear that is being expressed or question that is being asked by Dr. Poku Edusei of the University of Ghana? He says, what's become of the edict that there should be no international conferences, no hugging and handshakes in churches, etc., all because of Ebola? What becomes of that?
All these things have been withdrawn. If you cross-check, when WHO issued these guidelines, and it created panic that they didn't expect. And the panic was even becoming much more of a problem than the virus itself. In fact, if you observe, the Ebola phobia, as Uncle Kibako has referred to, is much more of a problem than the virus itself. And you would notice that after World Health Organization issued this particular one, people raised issues and they withdrew it. They withdrew these particular regulations and they came back with other much more friendly regulations to assure people that the first approach of Ebola is to ensure that you calm nerves and let people understand the real problem of Ebola, and not to be able to jump into certain conclusions that has a tendency of worsening our situation, because the fear of that disease is much more of a problem. And so we need to bring out good information, good scientific information about the disease, factual, and then let people understand that Ebola, first of all, Dr. Jensen has said it, that number one, it is only infectious when the infected person is symptomatic. That is, the person is under full-blown disease and the person is sick. That person cannot travel. Somebody who is sick and down of Ebola cannot travel. Right. So that's number one. He's made a good point, because the incubation period for the virus is about 10 days to 2 weeks. So what he suggests is that if they are going to stay in the country for more than that period, somebody could be harboring the virus and come in and then, pass the incubation period and become, sick and symptomatic. And even in that case, because there's evidence that people who have even lived in one room, and one of them had Ebola, and to the extent that the sick person was not touched by the people in the same room, they were not infected. Okay. So Ebola is not that infectious as we scared about it. But I can understand the concerns of people, because the information out there is scanty, and people are scared. They are thinking that...
You're a medical doctor.
That's right.
Is it your view that the approach that the West, like America, is treating Ebola, seeking to prevent it? You think it's panicky, it's not professional?
No, the United States, the first Ebola outbreak that occurred, and if you listen to the press conference that they did, the first thing they said was that, relax, calm down. This is not an epidemic.
But you know what they did? They did beyond simply giving information.
Yes. No,
That's in respect of, is it Eric Duncan?
Correct.
They traced him to where he lived.
Perfect.
Traced him to every contact, Thomas, right?
Perfect.
Every contact that he had made. Every contact, every single contact. So that there was the possibility of a clear way to eliminate the further infection. We are told that this other nurse who also contacted it, probably contacted it from him. The WHO is saying that so far 423 health workers have been infected. Do you think that we are seeking to offer help because it is in tandem with our president's promise as the head of ECOWAS that was it? We don't need to isolate. It is not the best thing to do.
First of all, WHO is clear on this. That, travel bans, banning of groupings, banning of activities are not the way to go. They've come out clear to say that what you said, that is contact tracing, is one of the key things that you need to establish, and you need to establish the protocols for contact tracing when you are having your program for dealing with Ebola. It's not about, saying that I won't shake hands, saying that I won't do this. No. Make sure that you have a clear procedure to address the issues. Your laboratory systems, you have to ensure that you have a good laboratory system that can do rapid diagnostics of Ebola.
And we have those?
We set up those. And again, at the airport, they set up standard screening measures. And all those who will be coming in through for this particular one would have to come through air, and then they would be screened at the point of entry. In fact, they can do multiple points of screening. At the point of exit, they could be screened. And at the point of entry, they could be screened. And we draw out a clear strategy for contact tracing, not just contact tracing. Also, we have to come out and demonstrate to the general public that in the event of somebody having a problem within a particular location, how it's going to be handled, and convince them. Until this is done, we cannot just say that let's rule out this, because it also has its benefits. You have to do the risk-benefits analysis of the particular situation and then take a decision based on which one scores the highest points.
Right. Thank you very much. And when we return, I'll find out briefly from you whether you think also that there's no point to be panicky about it and be scared and ask questioning that we do not have the best of assurances about government, the state protecting us against Ebola. Because, for example, we are hearing the president asking the military to join in the efforts to fight Ebola. So maybe we are aware of sufficient measures, and that's why we are opening up taking this very huge risk, as the professionals say. We're taking our final break here. We'll be right back. This is Newsfile, your most authoritative news analysis show. You're welcome back. Thanks for staying with us. This show is brought to you by Bank of Africa, strong as a group and close as a partner. Star Travel Policy from Star Assurance, that is your solid partner. MTN, welcome to the new world. Everywhere you go, MTN is there for you. Sasso insecticide spray, Sasso Kumuntuntum Preko. Wemplex 400, that's your one-stop dewormer for the entire family. Garden City University College, they want you to know that they have the best offers for you, so look for them in the Ashanti region, Kumasi to be precise. Of course, as I always tell you, Tanic Ghana, they are still doing their test drive, offering it for you. Just go and sit in one of their sleek, sexy, solid, alluring Jeeps and Cherokees and Chryslers and enjoy. The number to call is 0501 338 072. Now, I was asking you that question, that maybe we are prepared, but the president is asking the soldiers to come in, the army to come in to assist and everything. But listen to this question from Kwame Agoji. He says, I think your guests are not being broad in their look of this issue. Are we more soccer-loving than Morocco and South Africa, who have rejected the offer? Are we more knowledgeable than them about Ebola? Are we more prepared to handle Ebola than they are? Why are we considering a risk that they have assessed and deemed too risky? South Africa, they don't only say because of Ebola, but they also say, let me just read one portion of their statement. They say, our major concern, of course, remains the cost implications of such a tournament when South Africa is currently grappling with its own fiscal challenges.
Yeah, Samson, like I indicated, we have not gotten to the decision point yet. So it's not as if government has taken a stand to host the tournament for these questions to come about.
Oh, some have rejected. We have said we are ready.
No, what the sports minister said was that in terms of facilities, we are ready because we don't need to build new stadium. But we also want to look at our preparedness in terms of facilities. And if we get the medical fraternity telling us that it's okay, and I'm paraphrasing the sports minister, then we'll go ahead. So we've not gotten to the point that government has accepted and now these questions are coming.
It is possible that the medical practitioners will say, we are okay, we are ready. But Kwame is asking you, are we more prepared than Morocco and South Africa? Because we know that the facilities, medical facilities that they have, we do not have anything that comes closer to theirs. We have had Kolebu, literally unable to work in a day in the course of this week.
Yes.
Surgeries were not performed.
You see, the president has indicated that isolating Ebola victims is not the way to go. And that's why he made those whistle stops in the 3 countries to show to people that the approach is not isolism. Is that it? Is that a word? Isolation. Now, you would want to see a president who is providing leadership in the face of challenges. Ghana is noted for that. So we are not saying that we are going to infect our people with the Ebola virus, but we will be circumspect and ensure. Now, this government has put in place facilities. It may not be enough, but at least some attempts have been made.
Okay.
We have 3 of these centers. Tema is completed. We have Kumasi coming up and Tamale also coming up. There's even another plan to ensure that we put together what is called an incident operation center to serve focal points. So we will take all this on board, and I'm repeating that before that decision is taken, our facilities, even South Africa are complaining about their economic circumstances. we will also take those on board before we make that decision.
I see.
Our economic circumstances are known. We are broke. We are before IMF seeking help.
Yeah, even
Look, that's the point. Because we don't have money, people were not able to get medical attention in Kolebu. And Kolebu came to the limelight because it is right here by us. You don't know what is happening to the clinics and health posts around the country. You are saying this doesn't go contrary to the guidelines that have been issued earlier. The Ghana Bar Association,
Ghana Medical,
Ghana Bar Association,
okay.
was supposed to host, lawyers from elsewhere for a conference in Accra. They were asked to stop, so it had been stopped.
Yeah. So for instance, like this particular one
that's
you're
not a
talking
football
about.
tournament. Address what I'm saying.
Yeah, no.
It doesn't go counter to this.
No, what I'm saying is that when it happened first, Ghana, it was not WHO that issued these instructions. Ghana had said that, there should be a suspension of international conferences, in this country. So it was a Ghana decision. It was based on a particular information available to the country and the government at the time.
Government said it didn't want large gatherings.
Yeah, at that time. That's what I'm saying.
Was the basis for the cancellation.
Yeah, at that time. So there was a clear decision that they wouldn't encourage large gatherings, including conferences that would be bringing in people from other countries into Ghana at the time. Now, again, government is faced with a particular decision to take whether they would host the AFCON in this country or not. Now, complaints have been raised. You've raised the issue of economy, you've raised the issue of health systems preparedness, and you've also raised issues of how to manage the fear and panic. Now, what should be done is to engage CAF and say that these are the various challenges that we are facing.
Okay, just hold on. Sorry to cut you this way. I'm being joined by Professor Kojo Koram. He is the director of Noguchi, Center. That's the only place where we are currently testing for Ebola. Thank you very much, Prof, for joining us on the show.
Hello, good morning.
Right. So tell us, what's your intervention? Very instructive, I believe. Let's know.
Yes, I was listening to... Hello?
Yes, I can hear you, sir.
Yes, I was listening to the discussion, I think on the request to host the African Cup or something, and I've been interested into Ebola discussion, and I felt that maybe this was unintended, but really, if you're going to discuss such an issue, you should really get those who are working on it and those who have those who can comment better on the situation and things on it. I mean, specifically on this football tournament, some of the comments I had were that the issue around Ebola is to make sure you can do contact tracing and things. But the issue about the tournament is that each stadium holds 20,000, 40,000 people.
Right.
People are coming in, they're going to move from one stadium to the other. So you are going to generate, if you just happen to have one case out of those who went to the stadium, you are completely at a mess in trying to contact those who might have come into contact with the venue. And you should have a system to be able to pick up all those who went to the stadium, their friends, their relations, and things. So it's not a small issue trying to say that it's a question of trying to make sure you're able to take to control of contacts and things like that. So we need to be very, very careful about how we consider this. Ebola is not a small issue. It's not a small matter. So in a disease with a case fatality rate of 70–80%, what it means is that every 100 people who get a thing, the chances are that 80 of them will die, whatever you do.
Right.
And you don't want to do that.
So what are you saying? From where you sit, should we be considering it at all?
If you ask me now, from what I've seen in the country now, I would say no. We don't have the rooms to... If you have 100 people who are sick from any of this, all the hospitals will be overwhelmed because the people who go and see them cannot come and see anybody else. So we need to be very clear. We built a center at Tema. It has places for 10 people. So at one stadium, we generate 15, 20 contacts and things. We should learn from Nigeria. When that Liberian diplomat went in, he was the index case. they have to do more than 20,000 contact tracing before they've been able to do what they've done now.
Okay.
On one case.
Right.
Which was not in a stadium, but in a hospital.
So you are outright against even Ghana considering to host the AFCON?
Yes, because you're going to generate so many contacts. How about of being able to trace who goes where?
How about pitching for the 2017 instead of 2015?
That's a long time to pitch for it, and things, but the hope then will be that yes, we've had a handle on what is happening in our backyard.
From your technical perspective, when exactly are we expecting that Ebola would have vanished or died down completely on the?
Nobody can tell.
Okay.
Those who are on the ground now are telling us that the disease is far ahead of us in all our efforts that we're doing. So we need to catch up with it and then overtake it. And I don't know how we're going to do that at the moment.
All right. Thank you very much. Thank you very much.
Thank you.
This is
okay.
scary.
So that's Professor Kojo Koram, who is a director of Noguchi Memorial Institute, where is the only center for now that we test for Ebola. But we understand that there are other centers where, when the need it becomes needful, we can test Ebola at those places. We understand that so far there have been 9,216 cases. There have been 4,555 deaths, and these are figures from the World Health Organization. Senegal has had 1 case, 0 deaths. Sierra Leone has had 3,410 cases. They have had 1,200 deaths so far. Liberia has had 4,262 cases. They've had 2,484 deaths. About half, or more than half, of the cases that they have had. It gives you an idea of what Prof was talking about. Guinea has had 1,519 cases. Check how many have died. 862 so far. Nigeria, finally, has had 20 cases, and they have had 8 deaths. And they are being touted in Africa, or in the sub-region, as a country that has most successfully so far contained Ebola. Our time is up, but today we have a special edition, I understand. So I'll just let you just have your final comments, and then we close.
Well, that was quite scary.
The coverage of the NPP primaries will continue on your election headquarters. You don't want to miss it. Don't go anywhere. This is Joy 99.7 FM and Joy News Channel, your election headquarters.
Yes, that was quite scary, the input, the intervention. But as I said earlier, my head defers to the professionals because they know better. But my instinct has a problem with it. See, if this is the picture, are we suggesting for a moment that the qualifying series that we've been playing are manageable?
We just played Guinea.
Yeah,
the World Health Organization issued an alert.
So why then don't we suspend even the qualifying series? Are we being told that it's manageable? Because maybe 200-300 supporters would come from some of those countries. They interact with the thousands of Ghanaians who are there for hours. There may be people who are transmitting. So
people in Tamale were told not to have sex with the guys.
And who was policing that non-observance? Who was policing it? Huh? You're going to police that? So you see, well, I defer to the professionals. But are we then managing it? Well, we are playing qualifying, and they will come here. Hundreds or 200 of them. There's also the possibility of mass generation and transmission. I don't know. To be honest with you, I don't have a solution, but I'm scared.
You are the medical doctor by training. Do you still think that we should still be considering it? Is that what you think?
After listening,
there are people who say we can't even manage cholera. It's killing us in the hundreds.
I'm saying that, like Uncle Koku has said, personally, Prof. Koram is an authority. It's a big name. If you don't know, in public health, it's a name in Ghana when you hear, you know, it's enough. Whatever he says, whether you agree or you don't agree, it's
You
fast.
must bow down.
You understand? So for him to
So you take a bow?
oh, completely.
Okay.
And I think it's case closed.
Okay.
Yes.
Your final words. And we're supposed to also deal with the IMF's release. You know, before we finish, we concluded last week's show.
Yes.
You had been able to get the IMF's release, and you
Yes.
spoke briefly about it.
Yes.
Maybe you should spend some, 1 minute
Yes.
telling us what the IMF has
So-
had to
As
say.
well as the petition.
So now that
The Shraj
I'm
petition.
incompetent to deal with Ebola matters, I would deal with
like that.
the
He says you should do that in the petition. Maybe finish with the petition first.
The
You
petition.
said the petition had been sent from the
Exactly.
presidency to the Chief Justice.
Something, don't be caught up by those rumors. I said that the president has forwarded the petition to the Chief Justice. That is different from saying that the Chief Justice has received.
So it was on the road. Was en route.
Wait. You know that in our public service, even within the same ministry, you could deliver your letter in room 228. You go back to check in room 228 in that same ministry. They say that it has gone to room 240. You follow to room 240, they say it has not yet arrived.
So that's what happened in this case.
I'm telling you. So I thought that if they wanted to find out whether what I said was true or not, was not to find out from the Chief Justice Office. Was to find out from the presidency.
Whether it has left or not.
Whether
The judicial secretary,
wait.
whether
Now
he
that
had
I'm saying that
received.
It's wrong. I'm doing some logical analysis here.
Quickly, we have no
I'm
time.
saying that I sat here and spoke for the presidency. So if you are checking, you check from the presidency and you don't check from the. It's as if to say that your child, you ask your child, have you gone to school? You say, I have left home, I'm on my way to school. Then you call the headmaster and you say, has he gotten there? So it was wrong, the approach used by the media. Now,
Incredible. This is unconvincing. Don't blame the media.
On that day on IMF, I made a submission to the effect that it's either the IMF got it wrong or the Bank of Ghana got it wrong. But in any case, there was something which is wrong. So they need to reconcile. But I broke the news before this program ended by reading a message that came from the IMF indicating that really what they did was to focus ahead of time. And in my submission, I actually said that it depends on the cutoff point and the timing. And I even indicated on this program that as we speak, the Parliament has even contracted more loans. Has the IMF factored that in, and has the Bank of Ghana factored that in? I was asking and raising the questions. But the statement that came from the IMF put to rest all these matters.
Right.
And I think that...
So they made a mistake.
They made a mistake. They made a mistake.
Right. I suppose we can end it on that note. But also from last week, just a little update. You remember that Kuku referred to a law that speaks to the need for a specialized court to deal with the Auditor General's report that come to the parliamentary committee that is supposed to look at it. There's a Public Accounts Committee of Parliament. We read that law. We have our attention have been drawn to the fact that that law actually was repealed subsequently. Sometime is it in 2008?
Yeah.
And there's another law in place of that. And so the requirement that that law gives is no more what is required to have that court in operation. Thanks very much to Ace and Kuma. So the present court that exists is competent to deal with the cases that come to the Public Accounts Committee in the manner that is expected.
It's obvious that at 760 also needs some.
Yes, that one
tidying
too.
up.
Even the present law, there's a certain mistake. There is a mistake of Parliament, and they need to cure that one as well. Okay, so on that note, I want to say thank you very much, Dr. Maria Zakaria, for coming. Abdul Malik Kubaku Jr., who's the editor-in-chief of the New Crusading Guide newspaper and our regular panelist on this show. Also, Abraham Amaliba, who is a lawyer and with the NDC legal team. Kwabna Eje Japong, who is the National Secretary, General Secretary of the New Patriotic Party. This is your election headquarters. We'll continue to bring you the coverage of the NPP's primaries that is currently going on across the country. So stay tuned here. You hear the results first here on this particular platform, Joy 99.7 FM and your multi-TV Joy News channel. I'm Samson Ladi Ayenini. And the show has been produced by Sedem Ofori with assistance from all the guys who've been doing a wonderful job. My shirt, as always, is provided for by Latida. Have a good afternoon.